Welcome back to You Heard It Here with Dr. Gary. This is Earwax Removal Vlog number 106. Today, we're going to do part one of a video. We're going to look at a patient's ear, and yes, just one ear. This patient had a mishap and a crazy adventure with candling. Now, we've talked about candling on this channel before, and how it doesn't seem to be nearly as effective as people would like it to be. This patient is living proof. Their ear is just as packed, if not more packed, after candling than it was before. In my opinion, what happened is this earwax got warm and slid further down the ear canal and then re-solidified back by this patient's eardrum. They're really having a lot of difficulty hearing and some pain and discomfort in their ear. Now, we did talk to this patient about possibly visiting the ENT in order to use microsuction. They decided that they wanted us to just get the earwax out using the old-fashioned tool sets, which is kind of what we specialize in, so we were okay with that. If you like these earwax removal videos, please take a moment to like and subscribe. It really does help the YouTube algorithm and allows me to stay motivated to keep putting out these videos. Again, remember, this is just part one of this video. So we'll get one ear cleaned here, and then in our next vlog, we'll put out the other ear because both of them were just as nasty. All right, at this point, we've been digging with the curette for a few minutes, and the patient is starting to feel a little bit of relief in pressure. However, they're still not getting any hearing back. So what we're doing is we're using the curette to scrape the bottom of the ear canal to pull that wax up to see if we can't break the seal and give us more access to the eardrum. We're going to use the alligator forceps and see if it'll come out in a large chunk. And unfortunately, it looks like it's tearing down there deeply, so it's not going to come out all in one big piece. It was a little chunk, but nothing great. Again, this is just for entertainment purposes. This channel is not designed as medical advice, even though I am a practicing audiologist. I don't know your specific situation, and I'm not looking in your ears. So please take this information that we're giving you and just understand it is for entertainment and education purposes only, not actual medical advice. All right, so now again, we're still just trying to grab a large chunk of this earwax and get it all to come out. It doesn't seem to want to move with either the curette or the alligator forceps. So eventually, we're going to be using a little bit of irrigation in order to loosen this wax up and hopefully get it to come out in a large chunk. As we're pulling the wax away from the ear canal wall, this is the point at which the patient said they felt a little bit of a pressure relief and now they could start to hear a little bit better. But clearly, we are not all the way back to the eardrum, and there is just a lot going on. If there are any other topics that you would like me to cover in these videos that are ear related, please put a note in the comment section below. Be happy to respond to any and all comments, and hopefully we can find some topics that really interest our audience. You're starting to see it peel away from the ear canal wall here. It's looking like we're going to have to definitely irrigate, and once we do, the goal is that the water will get behind and around this earwax, allowing it to come easily out of the ear canal once we've got it established that we're able to get back there. Again, with the alligator forceps, that's a nice long chunk there that just came out. And now as we look back in, you can still see complete occlusion. Maybe a couple of little air pockets opened up because the patient reported improved hearing, but we are nowhere near finished with this patient. They were an absolute trooper, and they did great. This did not cause pain or discomfort for the patient. They were definitely irritated that they had paid to have candling done, and it was absolutely not effective, although they were told it was very effective because they were shown soot and stuff that came out of the ear and some wax. The assumption was that it came from the patient's ear. At this point, I'm pretty sure that that was just wax from the candle that had burned down onto the paper. There have been several other people here on YouTube that have done some great videos on these, including Dr. Olson. He put out a video showing what happens on a dummy when you actually do candling. and how effective or ineffective it really is. We're back to our scene here where we're representing the water because I didn't have another set of hands this day. So we're getting that ear all irrigated. Let's see what it looks like once we get into that ear canal now. So you're seeing a complete coloration change of the earwax, and we can now see past it up on this top left side of the ear canal. As we dig through, we're still breaking through the wall, and at this point the patient reported instant relief. The pressure was gone, the pain was gone, and of course the hearing returned immediately. After all that we removed, that giant chunk is about the same shape and size as the patient's ear canal. Let's look back in. No damage to the eardrum. Ear canal looks great. One side down, one to go. Stay tuned for the second part of this video. This has been You Heard It Here with Dr. Gary. Look forward to seeing you soon.